Hi, Steph. It's great to reconnect after our two episodes 39 and 41 on neuropathic pain. Thank you for taking the time for me to share with anyone who's watching this video what does it look like to be a student in the Pain Science Division Student Committee, and also specifically what's feel like and the experience of producing an podcast episode. So, as a first timer, how did you feel, and what was the process like from the start to end, just briefly?
So to summarize it, overall, I felt that I underestimated the process. I think I was a little bit naive in thinking how much work went into researching a podcast, getting the foundation so that when you go into it, you're more knowledgeable about the topic, you can ask insightful questions, and you don't seem like, not that you're wasting the time of the speaker, but you want to make sure that it's a valuable time so that you can produce a well-written episode rather than trying to stifle over it. I think one thing that I learned a lot from this is how important it is to kind of set yourself up for success. Through the podcast, getting the foundational research, making a question outline, and then interviewing the speaker. Throughout this, it was much more research and much more labor intensive than I thought it was going to be. But it was very rewarding seeing the final product come out. It was actually funny. One of my roommates, she's an OT as well. So she listened to the podcast and she actually really enjoys the speaker that we had on. So she found it really interesting. And it's cool to see that direct connection of people absorbing your content and learning from it. And it really just shows you that you can actually make an impact with the work that you do. So I really valued it that way.
How did you feel immediately after the podcast was put out? How did you felt about this whole process was done?
A very big sense of relief. I think it's just so nice when you work so hard to get some good product out. And then when it comes out, it's like you finally can kind of let that stress that was building and the anxiety towards completing a project, because this is something that people choose to do, right? And it's not something like that you have to do. It's not an assignment or anything. It's a passion almost. And I think that relief and then almost excitement that started building up too. Like I remember sharing it on my socials and like people were reaching out about it. They're like, "Oh, this looks cool. Let me give it like a listen to it." And it's nice to see the engagement.
Were you glad that you went through this process, and was it worth it?
Yes, absolutely. Resounding yes. In terms of was it worth it? Absolutely. It's hard to say the worth you get from something because you have to experience it yourself, I think, to get the full value of really appreciating it. Because prior to this experience, I didn't know what I was going to go in to expect with. I didn't know how it was going to turn out. But I ended up working a lot harder than I thought I was going to have to. And it was very, very rewarding. And I think it gave me a whole new perspective and new understanding and appreciation and a bit of passion too towards podcasting. I don't think I'll be able to do one until I'm done school, but it was really cool to kind of see the whole process.
And how was it look like to work with me? Because we did a co-hosting together.
I think you are very detail oriented, which is something that I really appreciate because it is almost like kind of like a guiding hand almost in a way. That's, I think, maybe a better way to describe it. With your attention to detail and your guiding hand, I felt like that I was being ushered to success, but it wasn't so much of you handing things on a platter and making it easy. You still made me work for it, which is hard to kind of figure it out, especially when you're new to the process. And for me, it was a little bit frustrating because I was like, oh man, like this seems like so much work. But it also gave me a reflection while I'm like, whoa, this is like one or two episodes. Like you've done like 30, 40. And I was like, oh. And it gives a different appreciation for it. So for me, it was a really humbling experience. And I think I learned a lot. And I really appreciated the guidance you gave, especially just seeing the process beginning, middle, and end. I started to understand all the work that went behind it. And I saw how each step led to the next and why each prior one was important and the foundation was important so that you're not scrambling or trying to make something out of nothing, I guess.
Yeah. Oh, thank you. What was the most difficult part of the process?
I think just going through all the ums and the ahs after when you're like going through the audio because you don't think you say it. I know I use a lot of filler words. I'm sure when this goes out, I'll be like, oh, I said like, I know I just said that just in this past sentence, but there's a lot of filler words and things that you can remove in excess. And removing that in post, you get a whole different appreciation of ensuring that you speak the most concisely with saying the most amount with the least amount of words.
Hmm.
But even that, like, even if I had to edit that phrase, like, it was a lot, but it was worth it because then the product that you saw was just so cohesive that it really worked out in the end. And you also saved like a lot of time. There's a lot of ums and ahs.
Yes. The editing process is commonly recognized among students after they've done it to be quite challenging and tedious, not gonna lie. But you really put out a product that is high quality, worth people's time to listen, and you become so aware of speech. And in fact, I think this is one of the life lessons we can take away is the communication skills from this process, and not just the research, not just the asking of questions. Yeah. How about the whole how about the larger Pain Science Division student committee? How did you find that experience being in the student committee?
It was really interesting meeting other students that really had a passion for pain. And it was interesting to see their different perspectives on it and their different reasons because no one had the same reason for why they were part of this student committee. And we had an opportunity to come up with case scenarios, talk about cases, and really just pursue the passion of just pain science, which is a very unique opportunity that I think not everyone has the chance to find like-minded individuals, pursue something that they're passionate about, and have that space to talk about it.
Hmm. How was planning the student forum?
It was it was nerve-wracking because you want to make sure that everyone is aware that communication goes out and there's so many things to be able to run it effectively that you don't think about. It's not just finding the speakers, promoting it, but it's also managing during and following up after because it's hard to make an event, but it's even harder to make and expand on the event in future years and try to build up this legacy almost so that it's not a one and done. It's no, that next time this also will be done, that this will be continual and it won't be a standalone event, that this could potentially be something that is yearly or even more often.
Hmm. Well, last final question perhaps here. What does this whole year of experience mean as you step into your physiotherapy career?
As some of our instructors say, you know a lot more than you think you know, but you know less than you think you do as well. And I think that's kind of been the summary of this whole experience. I have learned so much and so much valuable information, but the more I've learned, the more things I realize I need to not necessarily improve upon, but research and find out more information because learning, as we know, ongoing process, going into practice, especially first few years, you want to make sure that you're doing things in a way that can build your experience, build your repertoire, patient client skills, all that stuff. And yeah, I definitely feel like I don't know that much, but I know it'll come with time, of course.
Yeah. I'm
I don't know how
actually
have you been feeling with the first few years of practice?
I'm actually really glad that you say this to, and just share it vulnerably with anyone who's listening. And in fact, I think it's a really important mentality to have as a healthcare professional. You don't know what you don't know. And I don't know how better to help future clinicians really, store up this mentality and just to be humble that there is so much to know. So even now, I have success in my treating of patients. I still acknowledge there's so much room to grow. There's so much more to learn. Not necessarily making this sort of like an imposter syndrome, though I suffer it every now and then, but it drives me to continue to learn, yeah, and continue to be humble. Yeah. And you're amazed how some of these Paincast guests are so knowledgeable yet so humble as well. So I learn from them, not only from the knowledge side of things, but also just their way of approaching their careers. Good stuff. Thank you.
Thank you for your time.